Had a couple posts, I think stories earlier this week that were talking about cash pay PT and how most cash pay PT is absolute garbage. So I had a couple of people DM me and say, well, should I not go see a cash pay PT? I'm actually scheduled to see a 180 provider somewhere outside the state of Colorado somewhere, and they're cash pay, so should I not see them? So when I'm making the post about cash pay PT, 99.999% of cash pay PTs are not doing 180. So here's the thought process that goes behind cash pay PTs going into doing what they're doing. And this is possibly you, as you've already gone into cash pay, and I'm going to talk about why it's not working. And this might be you contemplating going into cash pay and what you should be doing before you do that so it does work. So the whole premise behind cash pay PT over the last couple of years is insurance sucks. Yes, it does. We don't get reimbursed enough. No, you don't. We have to do much paperwork. Yeah, you do. We have to jump through too many hoops. Yep, you do. So let's screw the insurance companies, and I'm just going to go cash and charge my patients cash pay. Okay, so you're trying to screw the insurance company. You have no effect on the insurance company. Understand that 20% of the outpatient PTs in the country could go cash pay tomorrow, and you're not going to affect the insurance company. So you're not screwing the insurance company. What you're doing is if you are going into a cash pay clinic or you're opening your own cash pay clinic and you haven't fixed your skill set, the only person you're screwing immediately are the patients who are going to come pay you $200 for what? The same crap you were doing in the mill, and eventually screwing yourself. So here's the problem. The bigger problem with outpatient orthopedic PT isn't insurance companies, although it is a huge problem. The problem is we are taking new grads and we are dumping them into the broken medical model and expecting them to fall in line and do what's expected and do what they're told and do what the script says and do what the protocol is, and not use any kind of thought process or any kind of treatment strategy that's based on science because, oh, whoops, we didn't teach you that in school. We taught you how to memorize a bunch of junk, but we didn't teach you how to use that in the clinic because you're going to learn that on your clinicals. Did you learn that on your clinicals? No, you didn't. What did you learn on your clinicals? How to do assessments, maybe a functional screen or something where you're scoring things and doing stuff that doesn't matter. Then you didn't learn how to take the important stuff that you should have got out of the subjective and the objective and apply that directly to a treatment strategy that's based on science because they didn't teach you how to apply neuromuscular physiology, apply biomechanics, apply functional anatomy. They taught you on your rotations how to do K-tape and how to do cupping and how to do stretching and how to do massage and how to do correctives. That's all bullshit. So you don't have the clinical skills, which is the biggest problem. We have PTs with very little to zero clinical skills, zero critical thinking processes, abilities. So what do? You take the information that you didn't get in your objective and your subjective, and then you try to apply a treatment strategy that has nothing to do with what you should have got over here because you didn't get it. Plus, PT school didn't teach you how to meld those two things together, which should be seamless, but it's not. It's do this, then do this. They're two separate things, which they shouldn't be. So now you're into a treatment strategy that can only focus on symptoms because the only thing you got information about in your objective and your subjective was where does it hurt? What does the pain feel like? What makes it feel better? Who cares? They have pain. So what you should understand is there's a problem somewhere. What they should have taught you in PT school and should have taught you on rotations was how to use critical thinking skills to take the important things that you missed over here and apply them to neuromuscular physiology over here, which is really easy, so you can get over here, which is results, and then educate them and give them an exercise program that's specific to them instead of taking out a piece of paper that has the 5 magic exercises and the 5 magic stretches, which never work because they're only focused on symptoms because you never evaluated anything. So the problem is you take that thought process and say, well, screw it. This isn't working. I'm not getting paid enough. I got to jump through too many hoops for the insurance companies. Screw that. I'm going to screw the insurance company and go off on my own. but you didn't learn how to evaluate correctly. You didn't learn anything about application of science. You have no critical thinking skills, which means you're still doing bullshit PT just wrapped up in cash pay. So now you've got to figure out, well, now I want to charge people $200 a visit, which means I have to spend an hour with them because more time equals more money, which is, again, completely wrong. If you can give somebody phenomenal results in 15 minutes and they only have to see you twice, you should be charging $200. If you're seeing somebody 2 times a week, 2 to 3 times a week for 6 to 8 weeks, and you're seeing them for an hour, you might want to charge them like $15 an hour because that's what you're giving them. You're giving them bullshit, which is stretching them out over a longer period of time. So stop thinking about charging people for time and start thinking about how much of a result am I giving them? Am I getting them back to dancing, working, playing sports, playing with their grandkids? If I'm doing that really quickly in 1 to 2 visits, even if my visits are 30 minutes, I should be charging them more than the clown down the street that's seeing them twice a week for 6 weeks and charging them more. That doesn't make any sense. So, if you have not gone out into a cash pay model, and that's what you're contemplating, do not do that until you fix your skill set, the holes in your skill set, the holes in your thought processes, because now you're going to go out and you're going to wrap up conventional PT garbage that doesn't work, needling, cupping, stretching, correctives, foam rolling, massage gun, Normatec boots, whatever bullshit you can throw at people to make them think they're getting this great treatment when all they're getting is wasting their time and money. And now they're wasting an hour with you rather than wasting a half an hour with you in the mill, and they're getting the same shitty results. They're just taking twice as long and paying twice to 4 times as much, which they're going to figure out. So you're going to be really happy once you get things going because you're going to sell somebody a package. But at the end of their package, they're going to figure out, I'm not any better than I was. And they're doing the same shit that the guy is down the street, and he only charges me a $40 copay for a half an hour. This clown is charging me $200 and I got to waste an hour with him. Why am I doing that? So you screw the patient, they figured out, now you're getting screwed because you never got down to the root cause of your problem, which was not the insurance company. It was that you never learned how to be a quality clinician. And now you're still stuck in the same situation, but now you own the clinic. So now when you don't have patients, you don't get paid. When you're at the mill and you didn't have patients, you're still getting a paycheck because you're still punching the clock. Now it's you, your investment, your name on the lease, your equipment that you bought to put in that clinic, and now you're not making money because your skill set sucks. And that's the situation that all of these cash pay gurus on social media want to sell you. Come buy my course. I'll teach you how to sell packages. Guess what they're selling? Bullshit physical therapy wrapped in some kind of marketing gimmick that people are going to figure out they're not as dumb as you think they are. So don't go buy some marketing scheme technique from some cash pay PT guru, because they're not going to fix your problem, and your problem is going to end up killing you. And your problem is your skill set sucks because you don't have the thought process, you don't have the skill set, you don't get the results, and people will figure that out and they will leave. All right. So the point of my post earlier this week wasn't that cash pay PT sucks. It's that cash pay PT wrapped up and put a cash pay PT bow on garbage old school PT doesn't work. But if you fix your thought process, if you understand how to apply the knowledge that you went to school and paid all that money for, if you figure out how to use that and educate your patients and use science and stay away from false narratives and nocebos and marketing gimmicks that they will figure out, if you figure out how to do that before you open your clinic, now you have a winner. Now you have a clinic that you don't have to market, because people will figure out, hey, I saw this person over here that does this thing that nobody else does, and I only saw them twice over the span of 2 weeks, and I was back 100% doing what I was doing. Whereas when I saw the person down the street, I went 2 times a week for 6 weeks and never got any better. So they're going to tell everybody that. They're going to tell everybody that. You got a mom on a sports team? She's going to tell everybody how her son got better with you after he wasted his time for 6 weeks with the guy who's doing conventional PT. and that will drive your business. So what I tell my coaching students when they get through the shift and we start helping them open their clinics is you should not be spending your time marketing. If you are giving your patients phenomenal results because you're doing something that nobody else does,